All right, hello everybody. I'm Brian, and we're here at AAMI Exchange Day 2 in Denver, Colorado, 2026. And I'm here with the recipient of one of our most prestigious awards, which is the Robert L. Morris Humanitarian Award for Health Technology, Lúcio Brito. And Lúcio, thank you for coming. You came all the way from Brazil to join us here today in Denver, Colorado, which is a very different environment, I'm sure. But it's been a great conference, and I hope you've been having a good time. Why don't you tell me a little bit first about your time here? What have you enjoyed? What have you seen?
Yes, it's different. I've never been so inside the United States, and I love the city, well organized, clean, a lot of interesting things that we don't have in our country. So I love to stay in Denver, Colorado, and thank you for the opportunity to be here at AAMI.
Oh yeah, and you get to see the HTM community of the United States and Canada and whoever else wants to come. We have a lot of folks from Japan this year, which is really interesting. But I wanted to talk to you today about your humanitarian work. That's what we're recognizing you for. But at the foundation of it all, you had said a quote a while ago that we wound up including in your award bio, which was essentially that sound engineering is the foundation for any kind of work in countries that are in need. So I was hoping we could start there. What did you really mean by that? Why do we need good engineering first?
Yes, I mean that we need a very good foundation. Mm-hmm. I mean, if you have the principles of engineering, physics, mathematics. If you are a good engineer, you can do a lot of things, not only for patient safety, but the quality of care. So we need engineers with a good engineering, because in the field, when you are in the field, normally you are alone. Sometimes you have some guys from the region, yeah. But you have to be good in electricity and mechanics and chemics, sometimes biochemistry and anatomy and things like that. But all of this will be better applied if you have a very good foundation. And that's why I translated to sound engineering. If I don't know if it makes sense, but
it does.
Well, that's why my idea.
A lot of the people here today, whether they be clinical engineers or health technology management folks, a lot of them will probably agree with you, like regardless of their specialty. Like say they work on X-ray devices, or they're just running around repairing the same mobile devices all the time. All of them are fixers first and foremost, and it feels like they all kind of. There's a level of curiosity to it too, right? You want to learn more, to be able to fix more things.
Yes, because you have two types of engineers, technicians, technologists.
Yeah.
You have the one that knows everything about nothing, and the one that knows nothing about everything. So I decided to be the one that knows nothing about a lot of things. So you have to be prepared to talk to that guy that knows everything about X-ray, or about mechanical ventilation, or anesthesia machine, or medical air compressors. So that's why sound engineering helps to understand. If you have a good technicians in X-ray and his or she is really good, and if you are prepared with this guy, you can go deeper, and you can learn more in that situation. So I decided my career to be, because the situations showed me, sometimes you have to be good in infection control and disease, another time you have to be good in sterilization, or mechanical ventilation, or air conditioning, water quality, oxygen production.
To bring the right fixers together to address the situation, you have to know a little bit of everything.
And you work as as a kind of translator, because you have to understand complex things, translated to decision makers, and if you make it easy for them, they can decide better. They have more. They feel their selves comfortable to make the decision to do or not to do.
And you've done this now, I believe, in 19 countries. Is that correct? You've gone around to address problems in 19 different countries.
During, in reality, more than this. But yes, if you look the entire career, is a little bit more than this. But in the period of pandemics, I have the opportunity to give support to these countries.
Mm-hmm. Working with the World Health Organization.
For example, a country asks for oxygen cylinders. So you have to ask them, what's the internal volume?
Yeah.
What's the pressure? What's the type of connection? Because we have different standards for different countries. And since simple things as a specification of a technology related to oxygen, until to go to the field, to stay 20 days in a country, running by boats, a motorcycle, planes with one pilot, planes with two pilots,
oh my goodness.
Planes without a hydro system to fly. So it's interesting. I like to do these things because you can see that if you are not there, nothing will happen. When they ask me to do this kind of thing, I say yes, I can do it.
I had this vision of you, going into hospitals that were in need in these countries and fixing things by hand on your own, becoming the engineer for that hospital. But it's not really the case here. It's more like you've become the captain of a team. They already have good engineers there, but they just needed the guidance.
Sometimes what I observe, engineers can need to sell their profession. For example, some countries they are known as biomed. For example, in my country, biomed doesn't mean nothing. It doesn't means people from biomedicine. Okay?
Yeah, right.
And what I try to say is that healthcare systems needs engineering. And if you need engineers, you have to use engineer, the word, because that's why I cannot say I don't like biomed, but biomed don't translate engineering. And I think I say that sometime I have to go to a country, a very tough travel, because in the country there are no engineers in this area, okay? So I went there, a very tough travel. When I arrived in the hospital, the first guy I met was an engineer.
He just didn't identify that way.
They don't sell themselves.
I see.
People from decision making didn't know about they have an engineer.
They had somebody there fixing things and doing it well.
And nobody knows.
Nobody knew.
So that's why I say that we have to make ourselves more visible and to use the word engineering. Doesn't matter if what the adjective, if it's electrician or mechanical or chemical. That's my point, and this way I work.
It's valuable. Engineers need to speak for themselves too and make themselves aware.
Exactly. It's simple. It's more simple.
Yeah. I'm glad you brought up your work during the world pandemic, during COVID-19, because I know you did a lot of really important work in your home country as well, in Brazil, because there was an oxygen crisis.
Exactly.
And describe that. What was the crisis exactly? So when I think of crises during that time, I can think of Italy where they had no ventilators. I can think of the US where it was just a distribution problem. What was going on in Brazil?
So the shortage of oxygen, as we had in Brazil, happened in different countries all over the world.
Yeah.
The city was Manaus. This is an important city in Amazonas state that we have. And Manaus is it's a big city in the north region. And from one day to another, there no oxygen.
So ran out of the supply.
Health professionals went to the media and crying, and because is the case. Some patients need just a few oxygen, and others need 100% FeO2 inspiratory fraction of oxygen.
Yeah.
And if you don't have oxygen in this situation, the patient will die.
Yeah.
Okay? So some days before, Inter-American Bank asked for help, and then I was there. And one of the things that I realized when I was almost sure what's happened, because some hospitals have the pipeline pressure too high.
Oh.
For example, in the United States, you use a 50 psi in the pipeline pressure.
Yeah.
In Europe, 60 psi. But in Brazil, we have sometimes 100 psi or 110 psi. So when you adjust the flow meter to 5 liters per minute, because the flow meters are calibrated to operate in 50 psi.
I see.
And if the pipeline is higher,
Double than that,
you deliver the double of oxygen.
Yeah.
So you have overdose, the eventual leakage that you have, you increase, and is a kind of mismanagement, you know, because the cycle is the doctor prescribe, the procurement buy, the engineering receive, but pharmacy should, because oxygen is a medicine, and we must have the pharmacist as the leader. We as engineer will help them, but as a medicine, it must be in the radar of the pharmacist. So after this, I come back to Amazon and I analyzed 11 hospitals, and I can prove I did not relate directly with overpressure, but the fact is that the 11 hospitals analyzed, all of them has overpressure, and that's why I suppose that this was one of the cases.
It was one of the causes,
that causes shortage. But it's an important thing I would like to say at this moment is that we created, I say we because it's a part of my job, but there is an organization known as Global Oxygen Alliance that was created to continue the effort we started during the pandemic. Because during the pandemic we expended $1 billion, and there are a lot of gaps as well. We published an article in the Lancet Global Health. I was a part of this, the commission. We did a lot of meetings remotely, and then we met in Uganda, Entebbe, presential, and after this in Stockholm, Sweden.
Yeah.
And the article was published past year. And this month, past month, we published another one after 1 year of the article. And there are a lot of possibilities of contribution in different areas, since donation until engineering, and we need engineers.
And it goes back to what you were saying earlier, right? We start with, as long as the engineers know what they're doing on the PSI side, you have your sound engineering there, the foundational. You can work your way up with educating and collaborating with all the other parts of the hospital, it sounds like.
Exactly,
right?
because what is important to understand is liquid oxygen is mainly used in industry. To make melt iron, you need in petrochemical, you have a lot of applications. Healthcare is only a small part. So if there are no big business, the manufacturer have no interest to put liquid oxygen in a region. So the production capacity is important, the adsorption technology, because we have PSA, VSA, VPSA, and solarization, because sometimes you don't have electricity, or the electricity, the fluctuation is too high. So, you know, we need guys interested in PSA, VSA plants, but we need guys that understand solarization, and you know, everything is connected, and that's why a fundamental engineering can help solve problems, a lot of problems. But we need as well the very specialized guys, the one that knows everything about only PSA.
I see,
You know, and we do the connections. If he knows production, we know about mechanical ventilation, anesthesia machine, or nebulizer, or small portable oxygen concentrators. So
It ultimately comes down to identifying the right solutions for the different countries. They're all so different.
and sustainable solution. We are
Sustainable
looking
solutions.
for not only train but fix these guys like me in a health system and retain them. And I say we have more sick hospitals than engineers prepared to treat that hospitals, because some hospitals are healthier than others. So kind of.
It comes down to optimization.
Exactly.
And that's like we'll be sure to put links in the description for those papers.
Okay.
We'll be able to include them in our membership. We'll be able to check it out.
It will be very good, because if you the papers, I don't remember, but has more than 60 pages, and you find the word engineers, you will see a lot of mention in engineers and technicians. That's why this article is very important. It was published by a very respected magazine. So it's we have the evidences. Now engineers must
seek the solutions.
exactly,
Fantastic.
in practice.
Yeah. Well, Lúcio, it sounds like incredibly important work, and I know it's just a small sample of the work that you've done over your many years, working, doing humanitarian work, but both just doing, as we say, sound engineering. So, hey, thank you so much for joining us, sharing a little bit of that story. I don't want to keep you from the rest of Exchange, but congratulations.
Thank you, Brian, for an
appreciate
opportunity to shed the light in our profession, and especially on oxygen, that we must continue. We have targets until 2030, and
Gotta
let's
meet them.
do it.
All right, let's do it.